Welcome to Science Force, where science comes alive.
Hello, and a very warm welcome to this explainer. Today we're unpacking a highly complex and, honestly, a deeply misunderstood neurological event, the migraine. For way too long, migraines have just been dismissed as a bad headache, right? But as we're going to see today, they are so much more than that. Whether you're someone trying to figure out your own pain, or maybe you're a life sciences student looking into the fascinating mechanics of the human brain, you are in the exact right place. So here's our roadmap for this explainer. We'll cover beyond a simple headache, inside the migraine brain, the 4 phases of attack, identifying your unique triggers, targeted treatments and therapies, and finally, reclaiming your daily life. Section 1. Beyond a simple headache, the global impact. It's absolutely crucial we start by just validating the sheer scale of this condition. A migraine is not simply a severe headache. An ordinary headache is usually just tension, a dull ache. But a neurological migraine? That is a profound physiological event. It's the result of highly abnormal brain activity that completely disrupts your nerve signaling, alters your blood vessels, and totally throws the chemical messengers in your brain out of balance. It's a chronic neurological disorder that genuinely impacts millions of people globally, especially women, and it often begins as early as adolescence. The absolutely crucial number to keep in mind here is 4 to 72. That is the number of hours a single untreated migraine attack can completely hijack a person's life. Just imagine being incapacitated for up to 3 days, unable to work, unable to study, or even open your eyes to the light. It's a massive, massive disruption to a person's quality of life. Section 2. Inside the migraine brain. The neurological roots. All right, especially for the medical students joining us, let's zoom in on the anatomy for a second. To really understand the pain, we have to look at the trigeminal nerve system. This is a massive nerve network responsible for the sensations in your face and, importantly, for transmitting pain. Now, during a migraine, this system is activated abnormally, and once it's activated, it releases these inflammatory substances directly around the blood vessels in your brain. That inflammation right there, that is what leads to that agonizing, throbbing pain that sufferers know all too well. But what's truly fascinating are the precise chemical imbalances happening behind the scenes. Your brain naturally relies on neurotransmitters to communicate, right? Well, when serotonin fluctuates, it can directly trigger an attack. When dopamine is imbalanced, it dramatically alters how you process sensory information, which is exactly why light and sound become totally unbearable. And then we have CGRP, or calcitonin gene-related peptide. This one is a potent inflammatory messenger. When these specific chemicals fail to maintain balance, it creates a whole cascade of neurological distress. So when you combine all these internal changes, the altered pain pathways, the abnormal nerve signaling, the disrupted sensory processing, and the changing blood vessel function, you literally get the perfect storm for a migraine. Oh, and we absolutely cannot ignore genetics here. If your parents suffer from migraines, your genetic predisposition to experiencing these exact same neurological misfires increases significantly. It really is a family affair in many cases. Section 3. The 4 phases of attack, a chronological life cycle. Let's trace the chronological life cycle of a migraine because, the actual head pain, that pulsing red phase we all think about, is really just one fraction of the whole event. A migraine is truly a multi-day life cycle. It actually starts with the prodrome phase, hours or even days before. Then, for some people, there's the electric warning of the aura phase just minutes before. This is followed by the headache phase itself, and finally, the faded blue of the postdrome phase that can just linger for days after. Let's break down those early phases a bit more. The prodrome. This brings some of the weirdest early symptoms. We're talking sudden mood changes, extreme fatigue, uncontrollable food cravings, or even just a stiff neck. It's essentially your brain's early warning system. The aura, experienced by about 25 to 30% of sufferers, is where things can genuinely mimic severe neurological emergencies like a stroke. You might see flashing lights or zigzag patterns, experience this tingling numbness in your hands and face, or even suddenly find yourself totally unable to speak or find the right words. It's incredibly scary. The headache phase, this is that agonizing, throbbing, usually one-sided pain that's accompanied by nausea and an extreme, frankly painful sensitivity to light, sound, and even odors. And the postdrome. Once that pain finally subsides, you enter this phase. Sufferers often call this the migraine hangover, and it makes sense because you're left with extreme tiredness, profound weakness, and a heavy brain fog that makes concentrating nearly impossible for another 24 to 48 hours. Now, I do need to warn you about a very dangerous complication known as status migrainous. This is a debilitating state where the migraine attack stubbornly lasts for more than 72 hours. It absolutely requires immediate medical intervention. And it's vital to note here that treating it improperly or simply taking way too many painkillers over time can actually cause medication overuse headaches, which just makes the whole situation so much worse. Section 4. Identifying your unique triggers. What sparks the attack? Okay, let's pivot a bit to some actionable information. Triggers do not cause the underlying neurological condition. We've already established that the migraine itself is a complex brain disorder. However, triggers absolutely ignite the attacks in a susceptible brain. They generally fall into 4 main categories, which are food-related, lifestyle, environmental, and hormonal. Let's rapid fire through some of the most common everyday culprits here. Food, skipping meals, or fasting is a massive trigger. Certain foods like aged cheese, chocolate, processed meats, and alcohol are notorious. Lifestyle and sleep, both a lack of sleep and, surprisingly, an excess of sleep can spark an attack. High stress is also a major factor. Environment and hormones. Bright, glaring sunlight, loud noises, and for many women, the hormonal fluctuations during menstruation are incredibly powerful triggers. The key is really to connect your own daily habits to your personal risk. Section 5. Targeted treatments and therapies. Fighting back. Let's zoom out now and look at the clinical solutions available to us today. First things first, you have to get a proper diagnosis, and it's a step-by-step journey simply because there's no single blood test for migraines. Doctors rely heavily on a detailed medical history and tracking your headache frequency. They'll perform physical and neurological exams, and finally, they might use imaging tests like an MRI or a CT scan. But do keep in mind, these scans aren't actually to see the migraine. They're used as a process of elimination to rule out other serious issues like tumors or strokes. Once you're diagnosed, basically treatment is split into 2 strategies. Acute treatments, taken during the attack to stop the pain. This includes your standard painkillers, anti-nausea meds, and specific migraine drugs called triptans. Preventative treatments. If you're having frequent attacks, doctors look to this route. This involves taking daily medications like beta blockers or anti-seizure meds just to calm the brain down. Excitingly, we now have revolutionary new treatments called CGRP inhibitors. These are designed specifically to block those exact inflammatory chemical messengers we talked about earlier. It's a real game changer. Section 6. Reclaiming your daily life. Holistic management. For our final stretch here, let's focus on how you can actually take back control. But before we look at habits, we absolutely must validate the mental health toll this takes. Migraines are deeply, intimately associated with anxiety and depression. I mean, living in constant fear of the next attack or losing days of your life to agonizing pain, it takes a severe toll on your overall quality of life. If you feel anxious or depressed alongside your migraines, please know that you are absolutely not alone. It is a fully recognized part of this chronic condition. But the good news is you can fight back with a solid toolkit of holistic habits. Try to maintain a very consistent 7 to 9 hours of sleep. Consistency is key for a sensitive brain. Stay fiercely hydrated and never, ever skip meals. Engage in moderate, regular exercise and practice active stress management, things like yoga or deep breathing. Most importantly, keep a detailed migraine diary. Tracking the dates, the foods you eat, and your stress levels is quite literally the single most powerful way to identify your specific triggers and reclaim your life. So, I'll leave you with this final provocative thought. What is your brain trying to tell you? Migraines are essentially your body's most extreme alarm system. Start tracking your patterns, listen closely to the signals, and take those proactive steps towards understanding your own brilliant, sensitive brain. Thank you so much for joining me on this deep dive explainer. Keep learning, keep tracking, and take wonderful care of yourself.
Thank you for watching Science Force.